So I'm going to share a couple different ways to get tested for adrenal diseases. And as I've mentioned previously, there's a wide range of different adrenal diseases and symptoms that go along with it. And there are also a couple different ways to get tested for each individual adrenal disease. The most common one that I hear about, or that people, I feel like is the most sought after, I guess, is the Stim test, which is a blood test that is testing the cortisol and the ACTH levels, as well as potassium levels and sodium levels in your blood. So I've heard that this can be done by a spit test, but it's not as accurate. Again, I'm not a medical professional, just sharing my understanding and what I have heard. But the blood test seems to be more effective, and that is drawing the blood at different times of day to check the different levels or lack thereof. There's also insulin testing, where insulin is injected into the veins and glucose levels are read. They can also do some urine testing to check different levels there, but sometimes they'll do an MRI or a CT scan or just an X-ray in order to see imaging on the adrenal glands or the affected area to see if anything is abnormal. And some of these conditions require specific diagnostic testing, but other ones you can do more than one way. However, just because there's a way to get tested for a particular adrenal disease doesn't mean that it's always going to be effective or give 100% the right answer, because I've heard of many cases of people with Addison's or secondary who go through testing, and the first couple times test results are negative, and then over time, as they're persistent because they know something's wrong with them, those test results do show positive later on. So being diagnosed and testing for diagnoses, testing to be diagnosed is an elaborate, stressful process that if you don't know anything about adrenal glands, or, which I knew nothing about, I didn't even know what an adrenal gland was 4 years ago, you're kind of walking in blind because your doctors aren't necessarily going to jump to the adrenal glands first. So the more you know about it and the more you're aware of it, and the more we all talk about it, the more that people can become aware of the type of testing that is out there and what to look for and know what to ask for. Because the only reason that I got tested for Addison's disease is because I asked to be tested for it. My great-grandmother had Addison's disease, and my mother reminded me of this. So when I went to my doctor, I said, my great-grandmother had Addison's disease. Is that something we should test for, when I was trying to figure out everything that was going on with me? And his response was, oh yeah, you are kind of orange, I guess we should do that. And that was just still an afterthought for him after I suggested it. So it's kind of a pain to get diagnosed, and you have to ask for it, and you have to be your health advocate, which I'll share more about later. But those are primarily the testing that I'm aware of in order to find out what's going on if you have an adrenal disease.